Hey y'all, welcome back to my channel. For those who don't know me, I'm B. Today we're going to be talking about what I wish I knew before attending nursing school. Before we get into this video, don't forget to like, comment, and subscribe to your girl's channel. And without further ado, let's get right into this video. So I thought it was really important to do a video on what I wish I knew before nursing school, because I feel like all the things that I didn't know and I found out in my time there, it wasn't a good time. It's just better to be prepared and to at least know what to expect rather than walking into a situation and not knowing what to do or how to react because you couldn't even prepare yourself. So I wanted to let y'all know what I didn't know before I went to nursing school and what I wish I knew so that y'all don't run into the same issues that I did. So I have my little computer here, my little iPad with the keyboard, because you know, your girl wrote some notes so I could just make sure I don't miss anything because I want y'all to get all the information that you can. So the first thing that I wish I knew before going into nursing school is that you have to clean up patients. So this might sound like really stupid because I guess you should know that going into nursing school, but someone who I will name unknown because they're like really petty for doing this to me, but when they were in nursing school prior to me getting accepted, they told me that during clinicals they never had to clean up patients, they don't have to do any of that stuff, like they have PCAs and CNAs on the floor to do that for you, which I just want to say, like, CNAs and PCAs jobs aren't to pick up after nurses, like their job is just to help and assist. So no, you have to clean up after patients. Just because you have a CNA on your floor working with your patient doesn't necessarily mean that if your patient has an accident, you could just leave out and be like, hey, go clean it. Like, no. They're not your slaves, like they're your help and assistance, as I said. So yeah, you have to clean up after patients, and I didn't know that. So I didn't take any of the precautions that you should have took. You know, if you're not good with potent smells, for me, like I'm not good with potent smells at all. But now I know that when you're cleaning up patients, if you have that problem, you have a weak stomach, you can use peppermint, you can use Vicks, and you can put it right under your nose and you won't smell a thing. I mean, I would say like on a scale of 1 to 10, you smell it like on a 2. Like it's so helpful. And now when I clean up my patients, like it's easy peasy, okay? I don't have no issue. Smells just get to me. I swear to you, y'all, if I smell something potent, like I might vomit, like I might throw up. Like my stomach is really weak when it comes to stuff like that. When I visualize, like see things that are disturbing or like vomit, blood, diarrhea, like that's whatever, like I can see it all. Like that's not gonna make me sick, I'm not gonna pass out. But smells, I'm telling you, like once that smell goes into my nostrils and like down into my chest and into my abdomen, like I might vomit, like I'm gonna get sick. Like there's a very high chance I'm gonna get sick. So for those of you who have a weak stomach when it comes to smelling, peppermint oil, Vicks. Put it right under your nose, leave it in your pocket, carry it with you so that you have it, because I'm telling you, those smells are not for the weak. Like especially if someone has a ostomy bag, when you have to empty it, it's very strong. When you have to clean it and change it, like that's no joke. So if you have a weak nose, get you some peppermint oil, get you some Vicks, because it's a lot to take in. With COVID, we got to wear masks, so I'm not gonna lie, like that did make it a little easier, but like diarrhea, vomit, you're gonna smell it, especially if it's excessive. Like you're definitely gonna smell it. Very heavy, like large open wounds, you won't get a good whiff of that too, and it's not easy. And as a nurse, like you have to be able to keep it together for your patient to feel comfortable, and it's not gonna take a minimal amount of time to clean, re-bandage, and disinfect a bigger wound. It's gonna take some time. changing ostomy bags, cleaning out, you know, an ostomy and rechanging it, all that takes time. So you're gonna have to keep it together throughout that whole time. If someone's having excessive diarrhea and you have to change out their bin, you have to clean them up, wash them, change their clothes, that's also going to take a lot of time as well. So you have to be able to keep your face together as a nurse, because you don't want your patient to feel uncomfortable, and you don't want your patient to feel like you can't take care of them because you can't keep it together. Like, nobody wants to feel like that. It's already hard enough being in a situation where you have to have someone take care of you and clean you and wash you already, when, you know, they probably were able to do it by themselves at some point. So it's very important to keep it together, and that does mean like facial expression as well. You have to be very mindful and very empathetic to your patient. So like I said, y'all, if you struggle with that, peppermint oil and Vicks right under the nose. What is the next thing? So another thing that I wish I knew before going into nursing school is that we can't do certain procedures. Like, for instance, we're not able to insert catheters. So for those of y'all who don't know, a catheter is used for someone who might have urinary incontinence, you know, or they might have strict I's and O's, strict intakes and outputs. So they would need to have a catheter inserted to either be able to pee, or because we need to monitor their output. I think they actually used to allow student nurses to do so, but since like there were so many errors, and I think it was causing like a lot of patients to have more infections, it was happening often, they stopped allowing students to do so. Putting in a catheter is a very like serious procedure, and it's not easy starting out. So I used to always like be waiting before school started and like my clinical started for the time that I'd be able to do so. They have us do it in our lab simulation, so I thought we would be doing it in our actual clinical, but we only get a chance to see them. But I've seen a nurse do it, and she did it once and she got the pee to come. And then I've seen a nurse have to insert 3 different catheters to get the patient to start producing urine. So it's not an easy procedure. It's definitely harder to do on females than it is on men, but regardless, it's not easy to do. So I wish I got experience actually doing them. The first time I'll ever insert a catheter will be when I'm actually a registered nurse. So that's very intimidating, and I'm scared but looking forward to learning. But it would have been nice to at least know and like have practice as a student, but you're not going to be able to do that because they don't allow it, so that is something to know. Another procedure they don't allow you to do is inserting IVs either. Like, that's an absolute no. My professors would tell me all the time, and like preceptors on our floor would say to us that they would just do it to other students, like they would do them on each other. Students in my program, I don't think they're doing that. Like, I haven't heard of them doing that, but inserting IVs are so hard, and like finding where to get the blood to draw is also really hard. So that I'm not looking forward to. I know nurses that have been in the nursing field for a year and they still have trouble. You know, it's not easy. I think that's one of the hardest things to do, and we get like absolutely no practice. I think we had like 1 lab simulation on it, but besides that, like, I could not tell y'all how the hell to insert an IV and be successful. Like, it's not easy. Like, I've had like appointments, like I've had appointments at like urgent cares or like Planned Parenthood to like get my blood drawn and stuff, and I'm telling you, like, some of the new nurses that will come in will be like, bear with me, like, this isn't easy. Like, I've been pricked probably like 10 plus times at one point. It's really hard. So I wish we got practice, or I wish that we could do them on each other. Like, we need to start that up, because I'm trying to learn before I'm in, you know, some hospital pricking a patient 10 plus times, and then they don't want me as their nurse no more because I can't find the vein. But yeah, that's also something that you don't get to do as a student nurse. Alright, so this is something y'all probably do know going into nursing school, because it's very rigorous, it's a lot of work. You're gonna have little to no leisure time. You don't get to really do much. But I mean, honestly, I am in the accelerated program, so it's much faster. We barely get any breaks. We get 1 break within the year, and it's only from December ending to January ending, so it's about a month, which isn't too bad, but we don't get any other breaks. And due to COVID, we didn't even get spring break for that week. We only had like a day off, so we really don't get a chance to get any breaks off, any chance to take any trips or anything like that. And you're going to be studying often. You're going to be doing a lot of rotations, probably a lot of assignments. Like, it's a lot. Like, you're busy, primarily. Like, your best friends are going to be in the program for that period of time, because you're not going to get a lot of chances to spend time with like family and friends. So just make sure that people outside of your nursing school just understand like you're going to be super busy, and like just make sure they're supportive and they're understanding about it, because again, it's not an easy degree. It's very hard. You got to stay focused. You have to maintain a certain GPA every single semester, and it's your life, it's your career. So just make sure that your friends and your family are aware of that, and like they're not going to see you often, because you got to be in those books. Like, it's not a game, okay? It's not a game. Like, that's first priority. So just make sure they know that, and just make sure that you know that, and like you can get that all together prior. So if you're in a relationship, best believe your little boyfriend, your little girlfriend's gonna have to understand like you got things to do, Like, you're gonna be busy, so as long as you make sure that everyone around you knows that, you should be good. Oh yeah, so I've heard people do this in my program as well, and my program is only 15 months. But for me, I don't think you could work full time. Like, I could barely work per diem. I would say when you get to like your last 2 semesters, they're so easy. Like, I'm in my second to last semester right now, and I feel like if I had a full-time job, like I could definitely work full-time. But like during your fall semester starting, and then like going into spring and doing med-surg, it's really, really hard. I know some people that didn't have a choice but to work full-time, and they passed and they graduated. And I guess like the professors work with them as well. I think if you have like really understanding professors and you're in a program that's extremely supportive, like they'll do that for you, and like they'll kind of like reason with you and like help you find times to study and get what you need to get going on. Also, like nursing school, like everyone in the cohort is a huge family. So if you don't have time to do a study guide because you're at work, someone's going to send it to you. If you don't have time to do a certain assignment, like someone will help you through it. We all are each other's resources, so if you do have to work full time, just remember, be open-minded to like talking to everyone, making friends in your program, because y'all are going to need each other. Get to know who has the best study guides, who knows the best websites, who has the best Quizlets, all that, because if you have to work full time, it's not easy. I didn't work full time. Like y'all know, I'm a COVID student anyway, so my job kicked me to the curb really quick. So like I wasn't working at my job for a really long time. I think they're like just now opening up, and they haven't even gave us like any specific time. It's been really, really crazy. But some people, do have to work, and like they can't just go to nursing school, I was blessed with a scholarship, as y'all know. Like that really saved my life, because if I didn't have that scholarship and I lost my job because of COVID, and I didn't have any way of paying for school or paying for my living expenses, I would not only not be in nursing school, but I wouldn't even be here. Like, I'd have nowhere to go. So, I encourage y'all to fill out scholarships and things like that, grants, whatever you can to get money, outside of having to work, so you don't have to be in a situation where like you're trying to work and do nursing school and you burn out, because the last thing we want any of us to do is burn out. It's not a good feeling. You get really stressed. It messes with your mental health. Like it's not an easy thing to overcome. So just make sure to keep that in mind. Everyone used to always tell me in the cohort prior to me, like the best thing you can do if you don't get any scholarships or whatever the case is, like if you are working, save up as much money as you can, and then try to make money along the way. But if I had to give y'all advice, go get a scholarship. Get a full ride scholarship that will pay for your tuition and pay for your outside expenses. Like, do whatever you have to do, and that will be the best choice, because that's what I did, and that's literally my saving grace. Like, I would not be where I am today without that scholarship. I'm telling y'all right now. So if that's something you can do, do it. Well, you can do it because like everyone can apply. So apply, look for scholarships, do whatever you have to do to make that money prior to nursing school, but try not to work full time because it can be a lot on you, a lot on the body, and just a lot on your mental health. Like don't do that to yourself if you don't have to. All right, so the very last and most important thing that I think all nursing students need to know is that nursing school prepares you to take the NCLEX. It does not prepare you to be a nurse. When you go into the nursing field, you're not going to be like ready and knowing everything you got to know and being the best nurse you can be. It doesn't work like that. That's exactly why they have you follow someone for months to a year, depending on the hospital or facility you're at, because they know that like you're new to this, it's not going to be easy and there's a lot to learn. I'm not saying nursing school is useless, because obviously like doing your focus assessments, listening to lungs, being able to tell the difference between like wheezing and cackling, abnormal sounds, like, you know, bowel movements, all that type of stuff, giving medications, giving injections, giving medications differently, whether it be through NG tubes, IV push, knowing how to do an IV piggyback. Like, there's a lot of things you learn in nursing school, so I'm not going to say like it doesn't prepare you at all, you know what I'm saying, how to be a nurse, but you are going to learn so much that you had no idea, you know, when you were in nursing school. And honestly, like, I have 2 to 4 rotations a semester. I probably did an IV piggyback once. So I'm not gonna like really remember fully exactly how to do an IV piggyback and put it in and like know exactly like what ml and things like that. So it doesn't really prepare you how to be a nurse, and it doesn't prepare you how to be the perfect nurse either, because you're gonna make mistakes along the way. It's normal. So don't feel like you have to know everything, or don't be overwhelmed or anxious when you feel like you don't know much, because that's completely normal. I'm telling you, every preceptor I've had during my clinical rotation, and like my clinical instructors have said, they learned everything they needed to know primarily when they started working on the unit. So keep that in mind. Don't overstress. Don't think that you gotta know everything. Just focus on passing that NCLEX, because that's what's gonna get you your license to become a nurse. So that is the biggest thing. That should be the only thing on your mind. All the nursing stuff that comes in with the job will come later. I promise you, they will take care of you there, and they will do what they have to do to help you be that nurse that you want to be. So don't worry too much. You got this. Just pass that NCLEX, okay? But yeah, y'all, so that was my video on what I wish I knew before nursing school. I hope it was helpful to you, and I hope the advice, you know, prepared you for, you know, when you go to nursing school. And I hope this advice helps you understand what to expect and how to tackle it, you know, if it does happen to you. And like I always say, if you have any questions, comments, or concerns, you can leave them in the comments below. Thank you for tuning into my video. I'll see you on the next one.